I'll be talking about celiac trunk, the blood supply, the branches to the GI tract. Okay, so let's talk about the celiac trunk main branches. The celiac trunk is divided into common hepatic artery, left gastric artery, and the splenic artery. This can be remembered by the mnemonic COOLS. The COOLS C stands for common hepatic, L stands for left gastric, and S stands for splenic. So the common hepatic is further divided into right gastric, proper hepatic artery, and gastroduodenal artery, which can be remembered by the mnemonic GRIP. So the G here stands for gastroduodenal, R stands for right gastric, and P stands for proper hepatic. The proper hepatic artery is further divided into right hepatic and the left hepatic artery. The left hepatic is further divided into cystic artery. The gastroduodenal artery is divided into supraduodenal, posterior, anterior, superior pancreaticoduodenal artery, and right gastroepiploic artery. This can be remembered by the mnemonic SPARC. Okay, and if posterior, anterior, superior pancreaticoduodenal artery is branch of gastroduodenal artery, then the inferior pancreaticoduodenal artery is branch of the superior mesenteric artery. Okay, it supplies most of the pancreas and also the duodenum. Okay. Moving on to the left gastric artery, the left gastric artery is divided into esophageal and gastric artery. Okay. The splenic artery is divided into four branches. The branches can be remembered by the mnemonic GPLS. G here stands for gastric, P is pancreatic, L is left gastroepiploic, and S is short gastric. Okay, and so this is actually a mnemonic, schematic mnemonic to remember the celiac trunk and its branches. It's called the city man. The city is the head, okay, which is the celiac trunk. This part is the thoracic part. These are the arms. This is the abdomen, and then the lower limbs. And these two here is the ears. Okay, so let's start. So the city head, okay, has three main branches, okay, which is common hepatic artery, okay, the same as this. The common hepatic artery goes this way, common hepatic artery. This common hepatic artery is the thoracic part of the city man, okay, and the two ears here is the left gastric, okay, and the splenic. Okay, so that was the thoracic and the head of the city scan. City man. Then the common hepatic artery further is divided into three main branches, like how we said, GRIP. Okay, so it's the gastroduodenal artery, the proper hepatic artery, and then the right gastric artery. Okay, the gastroduodenal artery is divided into SPARCs, right? So supraduodenal artery, posterior and anterior superior pancreaticoduodenal artery, and the right gastroepiploic artery. These are the branches of the gastroduodenal artery. Okay, then the abdomen is made of the proper hepatic artery, which is divided into two main branches. Okay, so the proper hepatic is divided into two main branches, which is right hepatic and the left hepatic. The right hepatic gives off a cystic artery branch which supplies the gallbladder. Okay, moving on to the splenic artery. The splenic artery is made of GPLS branches. So GPLS stands for gastric, pancreatic, left gastroepiploic, and short gastric. So this is the city man. And let's see how it is oriented in the stomach. So the city man is oriented horizontally within the abdomen. So the city, this is the head, these are the ears, okay, and this one here is the abdomen. Then this is the thorax, this is the abdomen, and then the lower limbs. Okay, now let's see what parts it supplies. Okay, and here we will also talk about the clinical correlations of the um, arteries related to the celiac trunk. Okay, so the celiac trunk gives off its main branches. This is how it is oriented in the abdomen. Okay, so this is the stomach, the duodenum, and the liver. Great. Okay, so this is the fundus of the stomach. This is the greater curvature of the stomach. This is the lesser curvature of the stomach. Okay, so the fundus of the stomach is supplied by the by the by the short gastric. Okay, short gastric, which is branch of splenic artery. Okay, now the greater curvature of the stomach, the upper greater curvature of the stomach, is supplied by the left gastroepiploic artery, which is branch of the splenic artery. The easy way you can remember this is the L in the left gastric and L in the splenic. So the lower blood supply to the lower greater curvature of the stomach is supplied by the right gastroepiploic artery. So the right gastroepiploic artery is a branch of the gastroduodenal artery. You see, the anatomical location of the right gastroepiploic artery is closer to the gastric and the duodenum, and therefore the right gastroepiploic artery is supplied by the gastroduodenal artery. And another easy way to remember it is the R in the right gastroepiploic artery is R in the gastroduodenal artery. Okay, so that was the greater curvature of the stomach. Then the lesser curvature of the stomach, the upper lesser curvature, is supplied by the left gastric. Okay, the left gastric is direct from the celiac trunk. Okay, it's one of the branch of the celiac trunk, left gastric. Like the cools, the L there stands for the left gastric. And then the lesser curvature lower part of the stomach is supplied by the right gastric artery. The right gastric is a branch of a common hepatic artery, okay, from the cools, C-O-O-L-S. So cools, which is further divided into grip. So the R there stands for the right gastric. If you go back to this, okay, the grip, common hepatic, the R there is right gastric. So this right gastric supplies the lesser curvature, the lower part of the lesser curvature, and the left gastric supplies the upper part of the lesser curvature, while the fundus is supplied by the short gastric artery, branch of the splenic. Then the upper part of the greater curvature is supplied by the left gastroepiploic, which is branch of splenic, and the lower part of the greater curvature is supplied by the right gastroepiploic, which is branch of the gastroduodenal artery. Alright, now two clinical correlations related to the gastroduodenal artery. Okay, if there is a peptic ulcer in this part of the duodenum, alright, so it can be a posterior ulcer or an anterior ulcer. Okay, if there is a posterior ulcer which breaks down, it erodes the gastroduodenal artery, and that can result in bleeding, GI bleed. Okay, so any posterior ulcer which breaks down, that erodes gastroduodenal artery. If there is a anterior duodenal ulcer, that causes air under the diaphragm because of any organ rupture. Okay, so those are some of the clinical relations. All right, so this is all about celiac trunk. In the next video, I will cover in detail about the superior mesenteric artery and the inferior mesenteric artery. Thank you. Keep watching.